So live 2.0, welcome everyone to SPRY webinar and thank you for attending this. This is a real treat because today we have Dr. John Lee as a part of our guest list. And it was a true pleasure to have you aboard. So I'm going to introduce you first, and then we're going to start off with a very good question. So first, Dr. John Lee is a physical therapist and an Oxford MBA whose career spans depth of clinical expertise, breadth of healthcare innovation. He earned his DPT degree from Virginia Commonwealth University and continued to refine his skills through orthopedic residency at Houston Methodist, as well as orthopedic fellowship, with focus on athlete performance, treating elite professional and semi-professional athletes. His clinical practice extended to women's health and community care at Providence St. Joseph's Hospital and Health in Portland. After pursuing his MBA at Oxford, where he competed as a two-time varsity athlete in American football and track and field, Jonathan expanded into pharmaceutical strategy consulting at Idea Pharma in London, advising on drugs development and global medical strategy. Now based in New York, he co-founded Pickle, leveraging his clinical foundation and business expertise to explore how artificial intelligence and emerging technologies can transform future of healthcare delivery and solve some of the most complex and pressing workforce problems during healthcare's workforce shortage. So without any further ado, Jonathan, welcome to our webinar.
Thanks for having me. I'm so excited to be here and great to see you again and great to meet everybody.
Awesome. So the first question, of course, is the most important. What is the biggest challenge that you're trying to solve with Pickle, and what have you found already on your pursuit to this excellence?
Absolutely. So at Pickle, we have actually a very basic problem that is straightforward but not easy. And the problem we're looking to solve is if great PT practices knew every single candidate in their local area, as well as where they worked, their setting experience, their specialties, etc., how would that change the growth pattern and growth trajectory of physical therapy clinics, especially as patient need scales with the aging population? The underlying problem is that we are a data and analytics company who's built AI to create a uniform candidate data for healthcare candidates because only 20% of healthcare workers are actually active on LinkedIn. So as we have more patients and more care gaps, it's really important for owners and managers to be empowered to know exactly how many people are in their area so that their recruiting team can reach out to them about any of their openings.
That's awesome and definitely very necessary. Being a person who probably spends three-quarters of my life on LinkedIn, it's an excellent portal, right? And so much information. So let's dig a little bit deeper into the, I guess, crisis that we're in right now, and that is what created this workplace shortage. And one of the first things I want to address is this compensation gap in physical therapy and just how our profession hasn't kept up between the cost of getting professional education and the actual compensation clinicians can mandate, especially in the first 5 years of their career. So what do you think on that?
Absolutely. So I'll break that into two parts. Where is the workforce crisis coming from, and how does that relate to physical therapy? Because I think those two are interrelated. The world itself is actually going through a workforce crisis over the next 20 to 30 years. If I used to be a consultant with the United Nations, and our data showed that the global birth rate was under 1.4 births per woman. 1.4 is the magic number where population stays the same. It doesn't increase or decrease. But what we found is because global birth rates are below 1.4, we're actually experiencing a global decrease in the workforce with a simultaneous increase in the elderly population who both need more care and draw more resources, right? And it's especially interesting to see this trend happen not only in healthcare and PT, but also other skilled labor industries that are regulated, like education. The teaching population has a similar struggles to the PT population. There's some differences in debt to income ratio, which makes the solution a bit different flavor. But overall, the world in the next 20 to 30 years is going to experience a workforce shortage. Now,
Yeah, yeah.
PT itself is like especially challenging in the US because we have limited opportunities to create more supply. We have limited opportunities to create more therapists, right? It takes 7 years to train a therapist before they're ready. Versus if you go to software engineering, which even though it's skilled labor, it's unregulated, you can be a software engineer in 30 days with a boot camp, right?
Yeah.
So in this way, the PT workforce crisis is magnifying the global issue of the workforce crisis. And by understanding that, we found some really cool insights and data points that help clinic owners recruit and hire more efficiently based on how the world is changing.
Yeah. So like that's actually a terrific segue to the next question. That just in the trenches, what are some of the strategies for the clinic owners to make this work, right? How can clinic owners balance providing fair pay to their employees and still generate revenue with the declining, just the declines in revenue production and declines in fee for service reimbursement? So what have you found in that to me?
Absolutely. I can tell you something that that's historically been really successful, but having dwindling success now, and I can tell you why. And that one is students, right? If we look at the numbers and the data about how many students we graduate in PT, it's roughly around 12 to 13,000 a year, right? The challenge with that, we've probably spoken to over 1,000 PTs in the last 6 months between second and third year PT school up to 2 years of experience. And what we found is on average, the new grad has 2 to 4 offers before they even graduate. So if you're thinking about that, if you have 12,000 PTs per year, and we're talking about outpatient PT, you can estimate about 2/3 of them will be interested in outpatient after graduation, which cuts you down to 9,000. And then you can assume that over half of them are going to have 2 to 4 offers, which leaves roughly 1,000 or less unaccounted for new supply each year, right? So if we're thinking about how PT clinics hire, student hiring is important, but it cannot be the only lever that you use to grow your practice and your patient impact because the numbers don't add up. Then we add another layer of information to that. If you look at estimates of attrition since COVID, they estimate somewhere between 10,000 to 20,000 a year of PTs leave the profession for various reasons. It could be actually burnout and understaffing is the most commonly seen reason we've seen. But overall, if we're thinking about 12,000 getting added every year and 10 to 20,000 getting taken out every year, a big emphasis is actually how do we fix the leaky bucket problem? How do we take good workers, good PTs who align with our mission, align them to the right employers so that they don't burn out and they leave the profession totally? And understanding this multi-channel, omni-channel approach to how we hire in this talent shortage is something that we've seen that really forward-looking practices are executing really well once we supply them with the data.
Yeah, so that's actually perfect. And let's discuss this term of burnout, right? So that's definitely a subject matter that's been omnipresent through the conferences, through just the professional rhetoric. But what is behind this burnout? What do you think is substantiating this burnout within our workforce? Is it more of a system issue, the fact that the system was just set up to go through these skilled professionals for them to want to leave their care? Or do you think it's a resilience issue? Is it just a selection bias that people who go into the profession may not be fit for this high rate, high volume practice model, and so eventually they just need to find a more fitting position?
Yeah, it's a great question. And I'll be the first one to say that the system is incredibly unfair as it stands for small practice owners, which we define as 10 or less locations, as well as PTs themselves, right? If you look at the research, I think Brooks in Florida has a great paper that came out last year about incentives for burnout in PT and things like that. But if you look at PT, OT nursing, actually the number one cause of burnout is understaffing, right? Because what happens? Our patient volume goes up, we're understaffed, we see more patients because we're one man or woman down on our team, right? Now, if you dig deeper into that problem, according to SHRM, which is the National HR Society, time to fill for clinical healthcare roles is anywhere between 6 to 9 months, right? So you're functioning in that for a long time. And on top of that, the biggest channel that's currently used for job placements is LinkedIn. But
Hmm.
LinkedIn receives roughly $2 billion a year from clinical healthcare posts that get zero applicants. On top of that, LinkedIn only has 20% of the available clinical population, 20 to 25%, give or take. So you can see how clinic owners are in this really unfair situation where there's a monopoly on the tool used, LinkedIn. The tool is
Mm.
not fit for healthcare. It doesn't tell you license. It doesn't tell you specialty, things like that. And the people that we need to see our patients are not even using LinkedIn unless they're actively looking for a non-clinical role. So then you have this effect where the few PTs on LinkedIn or even Indeed who are interested in clinical roles receive thousands of messages a month. And you can see that declining ability to see through the AI generated messages to understand who's a good fit for me and where would I like to bring my talents to help treat patients in a way that I find meaningful and that helps grow the business.
So do you see then this reducing friction in proper staffing as one of the main recipes to reduce the burnout in a clinical setting when you provide a proper fit?
Yes. So to use a general term, the hiring market in PT right now is a bit stuck. There's fewer transactions happening. Transactions we define as I'm gonna hire this person or I'm gonna take on this student. There are fewer transactions that are happening than are normal in an industry of our size, right? If you think about that, if it takes longer for you to hire, it takes longer for a PT to find a job that they like because they can't cut through the information, then that feeds into this burnout, understaffing issue at your current role, which leads you to leave the profession or look for a different opportunity. It's all interwoven, right?
Mhm.
In terms of how we see really, really forward-thinking practices deal with this, is we've actually seen practices do two things that I think are very smart from a financial perspective. The first thing is they're bringing in recruiting in-house because the existence of recruiting and staffing firms is killing the narrow margins that we already see as a PT practice, right? If you're making $100 a visit and you're paying that staffing agency 70, $80 an hour for that person, that number's not sustainable. And the staffing agencies know that, right?
Mhm.
But the challenge of bringing that in-house is that you have to do that first before you can apply AI efficiencies to your workflow in hiring, right? You can't optimize your strategy or your output if you don't have the system built. So now clinic owners are in this really tough spot, right? Where they need to dedicate more resources to a non-billable position, HR or recruiting, but that's necessary because the way we generate revenue in our industry is through billing patient units. So you have
Yeah.
this negative virtuous cycle right now in economic imbalance, which then it gets layered on top of the student loan, the debt to income ratio, the attrition into this really hairy problem.
Yeah, yeah, and then like it's a negative feedback loop, right? It's a
Yeah.
perpetuating negative feedback loop. But and so then let's gameplay with this. If you were like a John Smith Physical Therapy in Springfield, Illinois, you're a small enterprise. What are the two things you can do off the get-go to be more attractive to clinicians to come work for you?
Oh, absolutely. So the first rule that we've learned about scarce labor markets, like tight labor markets, PT, education, post-World War II industrial manufacturing is another great like historical case study, is that if you have less people you can draw from, you need more chances to reach that person, right? The days of a job post being your only way to attract candidates is pretty much gone, right? What this means is that multi-channel outreach, whether that's a phone call, a text, an email, uh, as in addition to your existing relationships with schools, with educational programs, things like that, they all need to fit together in a multi-channel strategy. Even just posting a single job on LinkedIn or Indeed, I was actually looking at New York City this morning, on the way, like getting ready for this web conference. And the first 7 pages of physical therapy outpatient roles were sponsored by large hospitals or national groups who pay LinkedIn tens of thousands of dollars, right,
Hmm.
per month. How is that fair for a private practice owner?
Yeah.
That's totally unfair, right? But what is really fascinating is when we interview these young people being students and up to 3 years of experience, the way to interact with them and they've requested is super fascinating. It's almost like we've gone back to the 90s where you would have coffee with someone, right?
Hmm.
In your area, your neighborhood. You would build that relationship and maybe 12 months later they would call you back and come back for a role because they remembered you. These Gen
Hmm.
Z kids are so good at cutting through AI. They're so good at cutting through the garbage, and they just opt to not respond because they know it's not relevant to them, right? So you need many
Hmm.
opportunities to reach this person at different times while personalizing across that person's incentives to start a conversation. The biggest roadblock we see is for companies who use like traditional outbound recruiting strategies where they're just emailing 1,000 people with like these huge emails with all their benefits and stuff. All that gets thrown into spam. The reason why that gets thrown into
Hmm.
spam is how Gmail and Outlook are structured on the technological end, right?
Hmm.
So overall, I think the takeaway here is blend multiple things together, sequence them in such a way where your highest converter goes first, because mathematically that improves your conversion number at the end when you stack all those channels together.
Yeah, yeah. Optimize the system, right? Instead of play
The
with the
funnel,
system.
keep the funnel as wide as possible at every step. If you know
Excellent.
email has on average a 2 to 5% response rate, email should not be at the top of your funnel, right?
Yeah, for sure, for sure. Like you are creating then an optimal solution to maximize capture, cast a wide net,
Yep.
right? So for this part, I want to welcome our audience to complete a survey while John and I are going to discuss this, which is would you describe current investment? Someone who's thinking of entering a career in physical therapy, is it a smart financial investment to pay for 7 years of university to enter the field? Do you think it's a viable option, or do you think if you were to do it right now, that you may have entered a different career?
That's a great question. And obviously there's different qualitative examples that everyone has, like based on why they make decisions, right? But if I'm thinking
Hmm.
about financial sustainability of a typical PT career path, that still exists, but it's increasingly challenging. For example, APTA put out a study earlier this year where the typical student has 119K in debt just from grad school. We
Hmm.
know from the US government that a typical undergrad debt is somewhere around 100K, 80 to 100K, give or take, depending on public, private, things like that. So if you think about that, if your starting salary for a PT, a new grad is, we'll say 85K if you're really lucky, and you're carrying a 250K debt load, you now have 3 times more debt than your income, right? If we look at someone like physicians might have 400 or 500K in debt, but their starting salaries are out of residency are going to be 200 to 500K, depending on specialty, area, geography, things like that. So what that means is like the debt to income ratio in PT is so far out of whack, even against other healthcare examples, that it makes finding financial sustainability in the career challenging, but not impossible. But I think what's really fascinating is really um, creative companies are using this to their advantage in PT. For example, building out not only student loan reimbursement programs, but scheduling them on a specific cadence where 25% is allocated at 6 months, 25% allocated at 12 months, 25% allocated at 18 months, etc., right? Because in that way, you've built in a retention mechanism and a growth mechanism into that hire you tried so hard to bring into your clinic, right? So that is to say, it's increasingly challenging, but the more challenges you have, the more creative ways there exist to actually differentiate your clinic against other clinics in the market.
Yeah, for sure. So I think that's like it's really duly noted, and then I think that is once again a perfect transition to the next topic to discuss, which is there are any system has modifiable and non-modifiable factors, right? And modifiable factors are these omnipresent friction points that we see within a clinic, right? And part of it is just how we set up a clinical workflow, whether there's a viable functional solution to optimize the care delivery process. And so some of these modifiable points are administrative tasks, administrative burden, right? These tasks don't generate revenue, but require a lot of time. So what are you hearing from the field? What are some of the practice owners doing to reduce some of these modifiable friction points in terms of administrative tasks?
The easiest way I can describe it I'm hearing is we're trying to reduce the amount of clicking that anyone in our company does. whether that's front desk, whether that's insurance, whether that's coding, whether that is therapists doing notes, whether that is even therapists or non-therapists helping on other functions, like a PT that picks up some marketing or things like that, right? The amount of clicks being reduced then leads to the ability to automate it, right? And I think there's three key areas that I've seen a lot of movement in, not only in the PT space, but also in the venture capital space, right? I'll exclude medical records because medical records is getting premature. You've got players like SPRY and Prompt, and even older players like Raintree and WebPT who have entered the market for some time already. But a really creative thing, for example, is voice agents for insurance denials and approvals, right? There's this entire kind of growth of companies who their whole job is to make the front desk make less calls so the front desk can focus on other tasks, such as recruiting, right? Or such as managing the patients in the door or scheduling or things like that. Another really interesting thing I've seen is the shift from web portals to text messaging. And I think the text messaging one's really interesting because now companies are developing software and using software that allows you to not only cancel and reschedule visits without the PT or the front desk ever touching it, but also adding in an AI layer where someone on your wait list is put directly into that slot and sent a text
Mhm.
message. Can you confirm, right? Again, just reducing the clicks, reducing the raw outputs. And then the last one I think is supply chain, right? I think everyone's kind of lived in that world where you talk to an Alexa and they bring you in more like TheraBands or things like that. But there's a lot of movement here in adding kind of lean Six Sigma principles to the procurement cycle, right? Where I can estimate that I use this much materials this month. It's keyed in by the exercises that this person did and the TheraBands that they're given and things like that. I can estimate when I need to renew my TheraBand order without having to think about it. And then that third party already has a contract with a medical device provider, which means you don't have to actually do anything. It's already at a discount and you just have to wait for it to show up.
Yeah, so absolutely. I think I really like that you're referencing the voice as an agent, right? Like voice as a access point to this data transference, and so I think you see such a huge uptake of voice-enabled solutions like a digital scribe and a voice-to-speech features within these platforms. I think the key for a lot of these features also is the way they were designed and integrated into these platforms. A lot of technological offering is essentially a mishmash of different function and different features that were never grown together. So there's just a complete fractured interoperability between them. And then there's newer solutions that you were referencing that I think were built organically from the ground up to have all of these features operate together. So besides the voice feature and besides the prioritization automation feature, what do you think some of the currently missing digital solutions that are present within the system
Yeah.
that, yeah.
This is a great question. I also want to answer this question in the chat because I think this is an awesome question, which we can answer at a future point after I get to yours. But I actually think medical record systems are kind of leading the charge in where PT software is going for clinic owners.
Mhm.
What we see, we being like me at Pickle, as well as like my VC hat, my venture capital hat, is these physical therapy software companies are transitioning to business in a box companies, right?
Mhm.
As a solo practitioner, I can have a single login, maybe two logins that gives me EMR, billing, coding, scheduling, recruiting, hiring, all
Mhm.
in one, right?
Yeah.
Now, some parts of that business in a box are more are more advanced than others, are more released, right? Like EMR is very advanced, right? AI scribe note taking, that was really big about 6 months ago. Now you see
Mhm.
even companies like Prediction Health getting acquired by Prompt and like building those flows in. But generally, what we're
Yeah.
seeing is we're seeing aggregation in the form of business in a box. I do think that the specific weaknesses of this right now are recruiting, right? Because
Mhm.
it's easy to sequence interviews. It's hard to get the interview, right?
Yeah.
So if you're in PT where you have 6 months and you get two applicants, it doesn't really matter to you that this software can help you optimize your interview meeting schedule. you need software that can source to get you those interviews, right? I think the other
Hmm.
barrier we see is on the billing side, which I'm super fascinated by. So basically,
Hmm.
when when like a code goes through an electronic system, it goes through what's called like a clearinghouse where a transaction is made and then like revenue is exchanged. What I'm fascinated to see is how these business in a box companies try to negotiate down that clearinghouse take rate, right? Because if you can reduce the amount of money that you pay this clearinghouse, that means you can return savings back to your customers, or you can also have
Hmm.
like a wider margin yourself. The everyday example is like Stripe, right? So like
Hmm.
Amazon and all these companies use Stripe for online purchases. I'm sure we've all used Stripe before. Like being able to reduce the cost to Stripe of its transactions through its clearinghouse then has a lot of impact upstream for the business owner because our reimbursements are declining already.
Hmm. Yeah, absolutely. I think that there's a lot of different innovative processes that are emerging, right? But we still haven't fully operationalized them, and we still haven't fully integrated them into our process. So I think that's right on. That's really cool. So let's talk a little bit about going back to that practice of physical therapy and the world of a physical therapist. And I think one of the problems is that there is a limited career advancement, limited career pathways within physical therapy practice. So essentially, we just already discussed the what, like how do you find a job, how do you get a job that you like. Now that you've been in this position for 3, 4, 5 years, like now what? How do you progress yourself from being an employee? How do you advance your career? So why do you think so many physical therapists feel stuck after a few years in the clinical practice, and what do we do about it?
Great question. Um, there's like two sides of this coin, right? There is the clinical skill side, and then there's the career advancement side. And I'd like to pass on what we've heard from young people about both of those, right?
Hmm.
In terms of the clinical career side, right? Students are feeling, and young people are feeling overwhelming pressure on student loans, right?
Hmm.
But there are also existing gaps in healthcare economics and career building in PT school curriculums. Like we never learn about billable rates. We never even learn about like what a good fit for our personality would be for a job or what this job expects from us, right?
Hmm. Yeah.
So if you think about it that way, advancement is a word that has no meaning because there's no way to kind of define it underneath for the PT, right?
Hmm.
I actually think, number one, that ownership or partnership is probably the most successful way of building a nest egg in PT, right?
Hmm.
The extreme of that is I'm going to open my own clinic, which comes with its own challenges. But also, we see the rise of these partnership and sub-brand models, right? Like where companies like USPH, they won't buy 100% of a clinic. They'll buy 1 to 99% and as a partner, because then that
Hmm.
money then allows that sub-brand partner to open a second clinic, which they can put someone as a new clinic director or as a new partner into that, right?
Yeah.
So career advancement track, I think in PT is rife for entrepreneurship opportunities, whether that's starting
Hmm.
your own clinic, even starting a cash pay clinic. Now that your average deductible in the US, I think it's like $9,900 or something crazy like that, right?
Yeah.
But also, there's this opportunity for companies who are looking to grow to partner in their growth to get an ownership percentage yourself without having to front all of the collateral, right? Putting your house or on the market and things like that.
Hmm.
The career advancement piece on the economic side is tough because of that gap in education, right? We don't, I had never heard of what a realization ratio, what that meant until I like was deep into business school, right? But
Hmm.
fundamentally, we as PTs don't know how we're getting paid. Like the average PT doesn't know how they get paid. They know they build these units, but they don't know the cost of those units, or even worse, they don't know how much the business owner has to put up with to even keep the lights on, right?
Yeah.
This career advancement question on the clinical side is super important because when we
Hmm.
ask young people, okay, if you got rid of student debt, what would you do? And it said, I would focus on being the best PT I could be. That makes sense, right? But then we ask
Yeah.
them another question, right? We say, hey, let's say you win the lottery tomorrow, right?
Hmm.
Awesome. Money's not a problem anymore. But let's say a week later, your parent is diagnosed with a terminal illness.
Hmm.
What would you do? The answer is always the same. Money doesn't matter. I'm sending him to the best person because this is like my family, right?
Yeah.
But then the next question is where it gets really interesting. It's like, okay, if you know the best people, uh, or you're saying if money's not a problem, you're saying the people you love to the best people, how do you become that best person in your career right now? And that helps
Hmm.
give a longer term view of how they're balancing the short term student loan challenges, right? Because it's super
Yeah.
easy to take 8% more money to go to home health, right? Or to take more money and go to travel. But at the same time, now you're stuck in Iowa seeing 20 patients a day at a facility with no one else because it's a travel contract, which leads to attrition, right? And this kind of
Yeah.
holistic understanding of what goals are and what resonates with young people, which ownership seems to resonate with them pretty strongly,
Mhm.
is something that I think allows clinic owners to be more creative in how they structure their own growth, whether it's like a partnership or an S corp or something like that.
Yeah, so essentially, well, instead of hierarchical model where you are the manager, so you are supervising all the KPIs, you are the employee, you are generating revenue, you're creating a more of an even playing field where you're working towards something else that's a partnership or something that it levels the clinical field and creates an opportunity for you to
Right.
grow in it,
Right.
right?
So like this idea of that young PTs need to invest just as heavily into their non-clinical skill set as well as their clinical skill set is really important to support especially smaller clinic owners who are looking for either the ability to retire and pass on the clinic to someone else or grow a second, third, fourth location, right? But the
Yeah.
challenge is for clinic owners is that you know that the economic knowledge is like a gap in PT school. So it's kind of scary as a clinic owner to share that knowledge you gained while building your business with this young person who might just leave anyway,
Mhm.
right?
Yeah, absolutely. That's right on. So that let's then discuss, like since we're already on the topic, the culture and leadership gaps, right? So as a clinician like that already has this potential equity in the clinic and potential growth potential, what do we do to reduce the culture and leadership gaps? What do we do to incentivize clinicians that are not in the early points of their career, but midway through their career, to take leadership roles and to start either training other clinicians to enhance their clinical decision-making skills? Like, what are some of the ways to enhance the culture of growth that we are currently
I
generating?
can tell you a fascinating thing that I'm seeing from someone in the Northeast right now, which I think is very smart. So we're right now we're active in over 1,000 companies in about 30 states in the US. We have mapped and identified 95% of the PTs in over 30 states, right? Like hundreds of thousands of PTs. And it's really fascinating to have this information and to see where these people move and how they move and where what jobs or specialties they move into, right? As you crunch all this data.
Hmm.
We've there's always been a second business vertical for clinic owners,
Hmm.
classically, right? The second business vertical is I'm gonna start a Con Ed course, right? Because I've already sunk the cost into rent for my building. I have some specialists. I can create courses or Con Ed courses to generate more revenue for my company where other people come learn from us, right?
Hmm.
We've actually seen really interesting, really successful companies use the Con Ed structure as a hiring tool, right?
Hmm.
And what that means is I know that this person has been at this job for 6 years and they're an OCS, right? They have not been put up for promotion yet, XYZ. I'm gonna have coffee with this person or reach out to this person, right? And give them an opportunity to either attend one of our classes or teach one of our classes, right? Attending one of the classes is actually pretty straightforward because all you have to do is add an extra chair, right? You've already paid for the course, you've already paid for the house, the building, and all this other stuff, right? So it doesn't actually cost the business owner anything or very much,
Hmm.
right? The second one about teaching is actually a really interesting incentive because when you have candidates such as PT or healthcare candidates who are already employed, their incentive to switch jobs is much lower, right? Versus if
Hmm.
you are a software engineer that just got laid off and you get this long job post with a link at the bottom, you're probably going to click that because you need to pay bills to feed your family, right? The psychological incentive for healthcare workers who all are coming from a job or are having multiple offers as a student, it's harder to sway them unless they see it and they feel it. But the way that
Hmm.
they see it and they feel it is they participate in it versus receiving an email or a voicemail or things like that.
Hmm.
Um, so using that Con Ed course as a recruiting tool, both for junior PTs where you offer a free seat, or more
Hmm.
experienced mid to late career PTs where you have them help teach something they're experienced in, right? As a sole proprietor or contractor or something, then they're in your clinic's ecosystem. They meet
Hmm.
your coworkers, they meet you as the owner, right? And they see how all the pieces for themselves fit together in terms of could I work here? Or do I even want to be here? And once you
Yeah.
have that human connection, just like inpatient care, the conversion is much more successful.
Oh, for sure. And it gives you a sense of agency, right? Like, so you become an agent in your own purpose and in your own development.
And it's just good practice because if you
Hmm.
think about it, like you're creating more content to sell to other therapists for to upskill them, right? But you're also providing this like potentially core addition to your company, an opportunity to make more money also, right? Through teaching a course, through being respected for their leadership, being respected for their expertise, specifically in that 6 to 10 year experience
Hmm.
segment.
Yeah. That's awesome. So let me just quickly review the results of the previous survey. Again, the question was, how would you describe current financial sustainability of a typical PT career path? And I think the majority of people who voted that it is somewhat unsustainable to neutral. So I guess the sentiment, at least from that small survey size, is that there's definitely some unsustainable parts, but it's still salvageable. It's not beyond salvage, right? So the next question would be, if you could eliminate one factor to stop therapist exodus, what would it be? So vote and rank. And the survey is out, but let's talk about this for a second. Like if there's a factor that we just discussed, right, which is the sense of agency, like if you can just have one as a practice owner, right, with limited resources, with limited revenue coming in, what would be the one factor to place in your clinic to keep the therapist from leaving the profession? So
Are we talking about hiring new therapists or are we talking about retaining existing therapists?
I would say retaining consistent therapists, like to keep clinicians from leaving for non-clinical jobs, to keep them in a clinic actually providing care, which is what their training is for.
Yeah, that's a great question. And I can tell you what I've seen work really well.
Hmm.
Especially in those folks who are at least 1 year in, like that first year of patient care, everyone's just trying to survive, right? Like you're trying to
Hmm.
turn your knowledge into wisdom and blah, blah, blah. What
Yeah.
I've seen a really interesting company on the West Coast do is
Hmm.
at your first year or at your first year of experience, not your first year with the company, right? They'll have a meeting with you and they'll go over very granularly, like, what are your goals? Like, do you want to
Hmm.
be an owner? Do you want to be a claim manager? Do you want to be a great independent contributor? What do you want to do? Are you interested in marketing? Are you interested in sales? Are you interested in education? Things like that, right?
Hmm.
And then what happens is after that kind of assessment is done, especially the small practices, which have this leverage point, which large practices don't, is they'll say, okay, here's what I think. You actually said you're interested in learning about the business of physical therapy, and you're interested in being an owner of a clinic, for example.
Hmm.
2 years from now, right? I want you to be in a position where you can either buy into part of this clinic or another clinic.
Yeah.
In order to do that, to be ready for this, at month 3, at month 6, at month 9, at month 12, I expect you to do this, this, and this. And it could be very simple. Like month 3, I want you to sign up for a community college finance class, which we'll pay for. We'll pay the $200 for, right? Because what we found is this company, which is about 12 practices, not super huge, but basically when they get to the end of the 2 years, right,
Hmm.
that person has already been trained and they've been ingrained in kind of what's expected of them. And since the measuring stick was already laid out in advance, if they don't get there, that's on them,
Of
right?
course. Hmm.
But if you think about it, if you work somewhere for 2 years, you should probably like the people already by virtue of being there anyway,
Of
right?
course.
So this clear long-term goal, no, not clear. This long-term goal of the clinician is super important to establish early, and then it's important to work backwards in time blocks to say this needs to be delivered on this, this needs to be delivered on this, this needs to be delivered on this. That
Mhm.
company has actually had really great success in doing split focus jobs where they at 2 years they will get a promotion, right? But they'll be
Yeah.
an 80/20 patient care social media manager, right? Or they'll be
Yeah.
an 80/20 marketing manager, right? Something like that. These are all tasks that that specific owner knows needs to be done to make his business run, but he doesn't actually have time for it. But it also builds in a promotion, and he's structured in the 20% time into slots that have the lowest patient volume anyway,
Mhm.
right?
Yeah.
So you've kind of worked the whole system to keep people as part of your team,
Yeah.
like spiritually.
And actually extract greater value for your organization, right? Because if you're a social media manager and a clinician, then you're doing something you're passionate about, but your organization, your clinic is actually benefiting from your output in social media.
Yeah, something I
So
learned very early on is you hire a 25-year-old kid to do TikTok. You don't hire a 55-year-old person to do TikTok. And not to be ageist or anything, it's just like the kids understand the algorithm even subconsciously.
yeah, for sure. And so that's actually again perfect because like understanding technology, but then understanding clinical utility, right? Like there is a tension point between technologists building something that nobody wants to use, and clinicians being in a state of cognitive dissonance, using these old antiquated systems without actually wanting to innovate and do something that develops a more efficient system. So I think there's a technological friction point, right? Like we have an abundance and proliferation of these advanced tech tools that have multiple features that never get utilized in the clinic. And then we have clinicians that are sticking to this mundane, redundant process of manually logging in all of the data, spending hours of their personal time documenting their notes, instead of actually being innovators, instead of designing tools or reflecting on the tools they have and optimizing them through either adapting to new systems or making the old systems more efficient. So, uh, what are some of the ways to get clinicians more involved in technology without actually leaving the field, but still being technologists while providing clinical care?
Great question. Um, there's two parts there. The first one is not all innovation is net positive or like value creating. And the second thing is how do we get our existing staff to create like net positive value for us, like to keep
Mhm.
them on staff, right? And I want to go
Yeah.
back to this first question, right? PTs can't work from home. Does this increase burnout? Does the result in increased burnout? This is an example of what you just said, Alex, about innovation doesn't always create value, right? So PTs can work at home, but the assumption
Mhm.
there is that they're billing under RTM codes, right?
Mhm.
Especially, and that's even neglecting telehealth. That's a whole nother thing, right? But RTM codes are coded at such a low value versus everything else that I actually have some friends that worked for these kind of like tech PT companies that ended up burning out and leaving PT. Because what
Mhm.
happens is they're basically farming clicks. They're
Yeah.
responsible for 60, 70 patients a day, sending them push notifications to get them to click it on their phones. Because once they click it, then the company can bill for it, right? I
Yeah.
think there's a very prominent digital PT company where the CEO said last year that he expects his PTs to see 70 patients a day,
Yeah.
right? Because it's all through that, right? So
Mhm.
so PTs can work from home, right? But it depends on what the business model is for that. If you're working from home, but you're getting $12 per RTM code and you're seeing 70 patients a day, you're going to burn out, right? Versus my other friend who found this really interesting niche where he started a cash pay home health business for hedge fund managers with Parkinson's here in New York, right? Very specific, very niche. And then that actually got him and his wife through a secondary grad school program that they both went through at Columbia, right? So
Mhm.
working from home can occur. It's just it's a bit more nuanced than just working from home reduce burnout in PT because the way that we provide value to our patients is so different than like what a business manager would do at home.
Of course. And it also goes to the essence of what is defined as physical therapist. The same digital health company you're referencing, right, are calling themselves a physical therapy provider, but I think an average physical therapist oversees 1,000 lives and is supposed to make 70 contacts a day. Is that really physical therapy or is that something else? And then we have legacy providers, which is essentially people that we cater to here at SPRY, are the people that have built their business over the years. They are a part of their community. So
Mhm.
now the question is, they have been an essential element in their community. They're providing highly necessary care. A lot of times they're the only clinical provider within a 100-mile radius, right? So what do we do then to allow these professionals, to allow our colleagues to be enabled through the digital
Yeah.
systems, through these advanced systems like SPRY, right? Like to be able to only improve efficiency, improve care provision, reduce that screen time, improve clinical care provision so that their data is being readily accessed.
Yeah. This goes back to your other question. Sorry, I missed it, right? About like how can we get our
Yeah.
PTs who are very smart, very bright. Like you don't get through PT school if you're not intellectual, right? It's a very challenging program.
Hmm.
Side note, I
Yeah.
actually thought PT school was much harder than business school was. It's like,
Yeah.
so there's that. What I see that is another leverage point for smaller companies under 10 that the larger ones don't have is actually going to their staff and saying, I have this problem. How would you solve it? And then you set a time frame and a deliverable. Okay, so
Yeah.
for example, I am having a lot of trouble attracting women's health patients. Okay,
Hmm.
how would you do this? What were some ideas that you have?
Yeah.
This is a big problem for us, and it's really important. In 2 weeks, how about this? We're gonna block out an hour twice a week, or half an hour twice a week, one patient slot something. You put that during a normally slow time, like 2 p.m. Like don't put it at 9 a.m. or 5 p.m., obviously, right? Because everyone's going off work. You put it there and you define what the deliverable could be, right? So
Hmm.
I'm having a lot of trouble attracting women's health patients, right? I think that there's a way to get the word out on social media. How would you do this? Here's a little bit of time over the next 2 weeks to work this, right? Because I know that you're interested in social media. Could you give me a 1 page summary that goes over your idea, the risks, and the timelines, and we could talk through it together, right?
Yeah.
So what you've given them is the expectations and the output. What you've given them is the problem, and you're relying on them, especially if they're a bit younger, to use their understanding of tech and their different viewpoint to give you an idea which you can accept or reject or iterate on anyway.
Hmm.
And especially as the owner, as you control the schedule, you kind of have an idea of when your lean times during the day are. So you've now actually empowered this employee to come from a different viewpoint while also having minimal impact on both your productivity, your unit productivity, as well as the not adding extra unpaid time for young people, which they hate because of that student loan debt issue from before.
Yeah. So and again, creating a positive environment, right? Reimagining the care that you're providing and creating avenues and opportunities for growth, which I guess in essence would be transitioning from a reactive system to being a proactive system, and a proactive
Yeah.
system that's involved in innovation and in process and progress, right? So I think that would be the less interesting question to cover then. What is our professional identity? And in your view, what is the future vision for us as a discipline in the United States for the next 5, 10 years?
I think that's very clear and very straightforward, but there's a bunch of regulatory challenges. The short answer is I think the healthcare patient workflow is probably going to be resequenced so that the most able provider at the lowest price point happens first.
Hmm.
Let me talk about that for a second, right? So right now, a typical PT will cost between 1 and 150 per minute. $1 or 150 per minute, depending on your benefits and your salary, stuff like that. Typical nurse is about 125 to $2 a minute, right? Physician is somewhere between 20 to $60 a minute, right? If we're thinking about that way, why do physicians always go first? Especially when physical therapists are musculoskeletal experts and nurses have chemical training, right?
Hmm.
The Cleveland Clinic did this study about 10 years ago where they actually did this exact thing where they resequenced care based on specialization and cost per minute, and their outcomes actually went way up. I think it's from 2014. They did a article in Harvard Business Review, right? Now, if we think about where healthcare is going, we know healthcare is really expensive. You hear these words like value-based care. right? Or you hear these
Yeah.
words like declining reimbursements, things like that. One of the challenges with our billing system right now is I think of the way CMS is set up is as a single door. There's a single door that's built for physicians that we're trying to shove every other profession through. But because the door was built for physicians through the physician fee schedule, it makes the other professions compete with each other and with physicians for like a way to get paid that actually doesn't reflect what we do. So what I
Yeah.
see in the next 5 or 10 years is as especially the US moves towards value-based care, some of the biggest costs to our system are low back pain and neck pain, right? Some of the biggest waste we have in the system is not trusting PTs and nurses as musculoskeletal and chemical experts to do some of the triage before they see physicians, right? And
Yeah.
resequencing that is, I think, is going to be necessary during value-based care, which means that the PT place is actually the front of the line for those musculoskeletal experts, but that's limited by how CMS deals with reimbursement right now. And you see
Yeah.
interesting companies circumventing this by doing cash pay or home pay,
Hmm.
right? Or things like that.
Yeah. Like you have to question the sustainability, right? And then value-based care is also, I think, well enough defined to be viable, but not everywhere, not in every avenue, not in every part of the country. So there's definitely a an opportunity here, right? But an opportunity
Mhm.
with a constraint. So now we're moving into the last 10 minutes of the webinar, the last 9 minutes of the webinar, and we're going to answer some questions from the audience. And let's address this question first, which is really important, and I think I would love to hear your answer. The role of physical therapy assistant, aides, and technicians in the current environment where there's a shortage of PTs. How do you see PTAs and techs fulfilling some of that, filling the gaps within clinical practice?
To be honest, I have never met a PTA who's a clinic manager who I was not impressed by, right? I think I think sometimes in healthcare we have this ivory tower complex where like we know physicians are the top and we report to physicians and then PTAs are assistants and things like that. But if I'm thinking about it, like PTA reimbursement's pretty low, or is lower than they can't do evaluations, things like that. But also PTAs just are so good with patients and they're so good with other humans, right? I think building those non-clinical skills for PTAs in particular, who've already gone through a 2-year degree program, um, is a really great way to grow additional managers, right? So like I think the PTA kind of glass ceiling is something that we can do better as a profession of breaking, right? I do think the future of PTAs is going to be more financially challenging for clinic owners because as there's fewer PTs, more PTAs will be more expensive, right? Same thing as with CNAs versus RNs, right? But I think there's a big opportunity for PTAs to also become partners and owners and things like that, and provide not only patient support but like operational support.
Yeah. Of course, and I think it's you see it everywhere else in healthcare where there's a well-defined distribution of responsibilities, and administrative responsibilities don't have to be defined by only PT or PTA, but certainly clinical responsibilities have a capacity of being equilaterally divided based on skill training and based on clinical need, where you can have clinics that are thriving by having PTAs take on a significant burden of patient care responsibilities and PTs doing most of that triage, right? So, right on. So, here's a question. How would I, as a PT, decide to work in PT only clinic, hospital, home health, or corporate? What would be?
Yeah. The short answer to that is it depends on how old you are, right? Because like for example, if you have children, right? Let's say you're mid-30s, you're probably more worried about benefits, right? Does my family have health insurance? The health programs will have better benefits, right? The health hospital systems. If you're a younger person, you're probably worried about getting out of debt as fast as possible and going to a place where I can like have that positive first technical step in my skill attainment, right? I think private practice is a great place for this, right? Because not only are does most of the business model innovation and benefits innovation come at the private practice level, but it also allows the person to the young PT to glean more skills they wouldn't get in a segmented hospital. right?
Mhm.
So in terms of all of that, I think it's now is also a really great time to explore what different benefits to offer as a small practice owner, right? There's a couple terms I want to share with the crowd just so you're aware of it. One of them is called an ICHRA, ICHRA, right? An ICHRA is basically a self-funded plan where you can give an employee $700 or $500 or whatever it is, and they can use that towards insurance plans on the exchange, right? Versus you spending $2,500 a head for your healthcare premiums for each employee. That's a really interesting one, right? So especially young people are going to default for less care, so they keep more money, but they appreciate that freedom of choice, right? That probably would not fly for someone who's 32, 33 with two kids and a mortgage.
Mhm. Of course, yeah. I think that like again, exploring what else is out there, right, and being open to new opportunities and new features that are available. So then there's a question, and I think we've covered a little bit, but it would be interesting to touch it. And this would probably be the second to last question. PTs can't work from home. Does the result of it increase the burnout? They see their friends from tech, finance work from home. So like, how do we, I guess, frame it that the fact that we are bound by brick and mortar site, and how do we create this environment and still optimize it without taking away from what we're responsible for, which is patient management, right? So,
Yeah, yeah, yeah.
well,
I see that question. I want to add one more thought to the previous question about how should I as PT decide to work in PT only clinics, hospital, home health, or corporate, right?
yeah.
There's three questions I would always ask myself. Number one, am I looking to climb the ladder and get promoted, or am I looking to coast, right?
Hmm.
Climbing the ladder only happens more quickly in smaller companies, right? Whereas if you go to a hospital, there might be one PT director for three hospitals. That person's not leaving until they retire, right? But at
Hmm.
the same time, hospital volume could be a bit lower. So early, if you're early on in your career, the first question is, do I want to like climb the ladder and expand my impact by managing lots of PTs who treat lots of patients, or do I want to stay within myself and be the strongest PT I can be, right? If it's the latter, you're only focused on the latter, hospitals tend to have more con ed support, right? If it's the
Yeah.
former, then that's probably more towards like a private practice outpatient or like a smaller home health company, things like that, where you can actually climb versus just be stuck as an independent contributor.
Hmm.
In terms of PTs working from home, PTs can work from home, but only for certain things. For example, if you're doing like direct point of care, face-to-face patient care, you probably don't want the patient to come to your house, right?
Yeah.
If you are doing home health and working at a patient's home, you aren't technically working from home, but you're working from outside the office. Right?
Hmm.
So is your question more about working from home or working outside the office, right? If you're talking about true PT work at home, that one is more challenging because the two predominant payment methods are telehealth, which is unstable, right? And RTM, which is high volume, low reimbursement.
Hmm.
So that way of working from home, even though you're at home, I find a lot of my friends are working 9 to 5, 9 to 6, no breaks. Like no
Yeah.
bathroom breaks, nothing, which is itself pretty challenging when we spend our entire lives on our feet and walking around and seeing humans.
Yeah. Yeah, that's for sure. Like, right, like I think, yes, that summary would be create your own optimal environment. You are responsible for your own agency and your own happiness, and so the system is responsible for enabling you and supporting you, but it is your responsibility to create your own happy state. So, Dr. Lee, I want to thank you for being a part of this webinar, and this was really a pleasure. I want everyone to check out Pickle and also come in contact with Dr. John Lee because I think it's just an encyclopedic knowledge of and a resource to our physical therapy community in the United States. I want everyone to find us at PPS, booth 807, find SPRY at PPS. And yeah, thank you. Any last words for you?
We have an amazing profession. We have a lot of challenges that are unique to us and also that other people are feeling. But I think there's a real opportunity for private practices to innovate to meet this challenge that maybe larger companies don't have access to the same flexibility.
Absolutely. Absolutely. We have to build it, right? So thank you again and appreciate your time.
Thank you.